Deep within your chest beats one of the most remarkable organs in the human body.
Every heartbeat sustains life, delivering oxygen and nutrients to nearly every cell. Your heart beats nearly 100,000 times every day, pumping thousands of liters of blood throughout your body without ever taking a break. Although the heart pumps blood to the entire body, it also depends on its own blood supply. The coronary arteries nourish the heart muscle with oxygen and essential nutrients. In a healthy artery, blood flows freely through a smooth inner lining, ensuring every heart muscle cell receives the oxygen it needs. Years before a heart attack occurs, microscopic injuries begin to appear within the artery's inner lining. These seemingly minor changes mark the beginning of coronary artery disease.
Low-density lipoprotein, commonly called LDL cholesterol, enters the damaged artery wall, where it becomes
trapped and begins a slow but dangerous process.
The immune system responds by sending macrophages to remove the cholesterol. As they consume more fat, these cells become swollen foam cells, creating the first stage of plaque development. Over many years, cholesterol, inflammatory cells, and connective tissue accumulate, gradually forming an atherosclerotic plaque beneath the artery's inner surface.
As plaque enlarges, the artery gradually narrows. Blood can still pass through, but the reduced flow forces the heart to work harder, especially during physical activity. For years, coronary artery disease may remain silent, but beneath the surface, an unstable plaque can rupture without warning, setting the stage for a life-threatening heart attack. Not every plaque is dangerous. Some remain stable for years, while others develop thin, fragile caps that can rupture at any moment. Chronic inflammation silently weakens these vulnerable plaques. Then, in a fraction of a second, the protective cap ruptures. Materials hidden inside the plaque are suddenly exposed to circulating blood, triggering an emergency response. Your body mistakes the ruptured plaque for a bleeding injury. Platelets immediately gather at the site. They stick together in an attempt to seal the damaged vessel. Within minutes, clotting proteins create a strong fibrin network. Red blood cells become trapped, transforming the platelet plug into a large blood clot.
When the clot completely blocks the coronary artery, oxygen-rich blood can no longer reach part of the heart muscle. At this moment, a heart attack officially begins.
Within seconds, the affected heart muscle is deprived of oxygen. Every cell depends on a constant blood supply, and without it, energy production rapidly declines. Without oxygen, the mitochondria can no longer produce ATP, the energy molecule that powers every heart, and harmful calcium begins to accumulate. As minutes pass, the injury becomes increasingly severe. Cell membranes lose their integrity, and proteins that normally remain inside the cells begin leaking into the blood. If blood flow is not restored quickly, heart muscle cells begin to die permanently. The longer the blockage remains, the larger the area of irreversible damage. As the heart muscle suffers, the body sends urgent warning signals: crushing chest pain, pressure, shortness of breath, sweating, and pain spreading to the left shoulder, neck,
Or jaw are among the most common symptoms of a heart attack.
As blood flow to the heart decreases, the body launches an emergency response. Stress hormones, including adrenaline, flood the bloodstream in an attempt to keep vital organs supplied with oxygen. A healthy heartbeat depends on precise electrical signals. Damaged heart muscle disrupts this delicate system, increasing the risk of dangerous rhythm disturbances. One possible complication is ventricular tachycardia, where the ventricles beat dangerously fast. Although the heart is still moving, it pumps blood less effectively. If the electrical system completely breaks down, ventricular fibrillation may occur. Instead of pumping blood, the heart simply quivers, making this a life-threatening emergency. When the heart can no longer pump blood effectively, oxygen delivery to the brain and other organs rapidly decreases. Without prompt medical treatment, this condition can become life-threatening within minutes. Rapid medical care is essential during a heart attack. Healthcare teams quickly assess, monitor heart rhythm, provide oxygen, establish intravenous access, and prepare treatments. When ventricular fibrillation is present, rapid defibrillation can reset the heart's electrical activity and restore an effective heartbeat. Modern diagnostic technology allows physicians to evaluate the heart within minutes. Electrocardiograms, blood tests, and coronary imaging work together to identify blocked arteries
and determine the most effective treatment.
As heart muscle cells die, they release proteins known as cardiac troponins into the blood. Elevated troponin levels confirm damage to the heart muscle.
Coronary angiography allows doctors to see the blocked artery in real time. Once identified, treatment can begin immediately to restore blood flow and save the heart muscle.
Support the channel by liking this video. Subscribe to MedVision 3D.